how common are these tears, right? This is another feature I think you need to understand. Superior labral tears are diagnosed with extremely high frequency in 45 to 60-year-olds and in an asymptomatic shoulder, okay? So you're saying, okay, common. What's common? It's relative, right? So let's put some numbers to that. So this study that looked at subspecialty trained, orthopedic specialized musculoskeletal radiologists were able to go in and say, hey, what percentage of these patients that had zero symptoms, okay, their shoulder's fine, between the ages of 45 and 60, how many of them had tears? Well, one radiologist said 55% of them had a labral tear, and the other radiologist said 72% of them have a tear. So that's our range there, is 55 to 72%. So again, they don't agree, right? There's almost a 20-point differential on whether or not we even think they have a tear. And understand that this information is being used to determine whether or not you go to surgery. And the variance, in my experience, is even wider among surgeons, okay? When a surgeon looks at it, they may just say, oh, the radiologist was wrong. This looks like a tear and I can see it here. And hey, and I don't disagree. I find things like that as well. Radiologists are busy. They kind of scan, go too fast, and maybe they miss something. So, and this is why you'll find that Regenexx doctors, Regenexx trained physicians, and here at Orthobiologen, we never base our treatment decisions on a single imaging modality. So we actually have at least three that we use routinely. And so, we look at this from multiple angles. We have the capacity to do and routinely perform. One thing I always do on patients for shoulders is we're going to evaluate you using high frequency ultrasound that allows me a higher resolution even than an MRI, and we can see things as small as a millimeter on the screen when we find defects that are difficult to be seen, and sometimes they may look like just tendon inflammation, and in fact they're actually small tears that we can pick up in ultrasound. The other thing is that we have a dynamic ability to move the shoulder around, and the patient can actually show us, and we can actually palpate at the same time we're doing imaging to see, does that actually corroborate the pain? Does that link to the pain? All of this is move in one direction, and as you see the gentleman here, not much has changed in the approach in 100 years of looking at these things. Okay, we're still basically taking different forms of expensive rope and tying things back together, and essentially trying to get them to function like a normal shoulder, and that's challenging, right? So we want to try other things.